Good afternoon. Thank you all for joining us today for the Lytham Partners Fall 2021 Investor Conference. My name is Joe Dorame, Managing Partner of Lytham Partners. Up next, we have our healthcare panel presentation, The Future of Home Healthcare. Our panelists are Rich DiIorio, Chief Executive Officer of InfuSystem Holdings, Dr. Lisa Crossley, Chief Executive Officer of Reliq Health Technologies, and Casey Hoyt, Chief Executive Officer of Biomed Healthcare. For today's event, I have asked Brooks O'Neill of Lake Street Capital Markets to act as our moderator. It is my pleasure to introduce Brooks. He's a senior research analyst with more than 30 years of capital experience. Brooks covers healthcare service and device companies for Lake Street Capital Markets. Before we begin, Lytham Partners is one of the country's leading investor relations firms with more than 2 decades of experience. We've built an industry's most diverse and effective platform for connecting small cap companies with high quality institutional investors. Hopefully today's event is another example of how we can add value. With that, let me turn the floor over to Brooks, and thank you for leading today's discussion. Brooks?
Thank you, Joe, and thanks to Lytham, and thanks to the panelists for participating today. I thought we would start by asking each of you to briefly introduce yourself and tell us a little bit about your company. Lisa, why don't you start?
Okay, sure. Thank you. My name's Lisa Crossley, and I'm the CEO of Reliq Health Technologies. And our company allows patients, particularly chronic disease patients, to receive virtual care in the home. So it lets their clinicians monitor them from the comfort of their own homes to prevent hospitalizations and ER visits. And we're targeting the $100 billion virtual care chronic disease management market, primarily in the US.
Great. Casey?
Casey Hoyt, CEO of Viemed Healthcare. At Viemed, we put respiratory therapists in the homes of very sick patients, typically a COPD patient or a neuromuscular patient that is leading to, or the patient is, their lungs are going to fail, leading them to chronic respiratory failure. So our patient is with us for about 17 months. It's an end of life type of term, but it's at the period of time where they're most prone to going in and out of the hospital, burdening the payer with unnecessary costs. So what we do at Viemed is we minimize those costs and try to treat as much of it in the home as possible.
Great. Rich?
Hi, Rich DiIorio from InfuSystem. I've been the CEO here for about 4 years, and I've been with the company for about 18. We're really a DME services company with a fleet of about 110,000 devices. We cover all 50 states in Canada. And what we do is we really allow the continuity of care for the patient that's on a medical device to get out of the hospital and into their home to recover and get treated. And that can mean infusion pumps for chemotherapy or pain management, pneumatic compression devices for lymphedema, or devices for negative pressure wound care. And we really can do that because we have about 750 contracts in the US that cover 95% of the lives, so that we can actually get reimbursed for that. And in doing so, allow the patient to recover at home and get treated and save the healthcare system quite a bit of money in doing so.
Great. So since the title of this panel is The Future of Home Health, I was hoping each of you would share with us your vision for what that might look like. Rich, why don't we start with you?
Sure. So, the trend for years now, or at least the last handful of years, has been to get patients home and out of the hospital. For multiple reasons. Number one, the cost of the healthcare system to have a patient in a hospital bed overnight is ridiculous. If you can get them home and get them treated, you lower your risk of infection. Patient satisfaction goes up because they can be home with their family and recover and get treated. And that's been going on now for a few years. I think COVID certainly put the spotlight on that. We know there aren't enough beds, and COVID pointed that out to everybody, that you need those beds for people that really need them, not for somebody that can go home and get treated. And as devices get smaller, technology gets better, telehealth companies come into play and support those devices and those patients. You can really drive patients home, which is where they want to be, where they should be, and where it saves us all a lot of money. And we know that the outcomes ultimately are better for the patient themselves. So I think it's something that's been going on for a while, and that's why all 3 of our companies have been around. But I think it's going to accelerate and has been accelerating now for the last 18 months or so.
Absolutely. Casey?
Yeah, I agree with Rich that all of the trends are pointing towards treating more patients in the home. I will say that even the hospital systems around the country agree with this trend. They're developing more hospital to the home types of programs. You're seeing them want to collaborate with home care providers more and embracing this trend, not fighting it, if you will. It's just a natural thing that we're going to keep more patients out of harm's way, and we're going to free up more hospital beds by treating them in the home with home health clinicians, if you will. The other thing I'll say is that reimbursement in the future should change as well. We're moving away from fee-for-service and more towards a value-based type of reimbursement arrangement. And, that's going to reward the quality care provider who is generating positive clinical outcomes for their efforts. And so that's a positive trend that is going to play into all of our hands here on this panel as well.
Great. Lisa, what's your view?
Yeah, I certainly agree with Casey and Rich on all of their points. More broadly, in the general population, 20% of the population have chronic diseases like high blood pressure, diabetes, kidney disease, chronic obstructive pulmonary disease, congestive heart failure. But that 20% account for 70 to 80% of all healthcare spending. So we refer to the chronic disease patient population as the super users in the system. And the reason that they cost the healthcare system so much is because they're frequently hospitalized with what would otherwise be preventable complications. And so the move towards virtual care and care in the home instead of the rescue care in the hospital not only provides that better quality of life for patients, but radically reduces the cost of the healthcare system. Because these are complex patients and they're often older patients, when they are admitted, they're in the intensive care unit for several weeks at a time, and that's hundreds of thousands of dollars per admission to the healthcare system. So really, in order to fundamentally move the needle on healthcare spending, this trend towards moving more care into the home and making it more proactive and preventative is really what's going to make the healthcare system as a whole sustainable going forward. Great.
It's my experience that one of the key issues in sort of changing and driving healthcare is reimbursement. So I'm hoping each of you will talk a little bit about who pays you, how much they pay, do they pay enough, and what are the trends of reimbursement that you've seen in the recent past? Casey, why don't we start with you?
Sure. We get reimbursed by Medicare. 60% of our payer mix is Medicare, and the other 40% comes from private insurance and other payers. Our patient is aging, so they're typically over 65, and that's what drives that trend. Traditionally, we are reimbursed by DME equipment codes, if you will. So a ventilator code for our vent patients, a CPAP code for our PAP and sleep apnea patients. We have seen a program called competitive bidding come out in about 4 or 5 years ago, and it was designed to establish a fair market value for reimbursement, having all providers bid on what a fair market value might be. That program did some good. It prevented the draconian rate cuts that we saw before the program came on board, but it's gone away recently. It won't be back until 2024. The reason for it is that they've already established a fair market value. We've never seen the reimbursement be more stable from a respiratory equipment perspective as we have in 2020 and 2021. So I'm excited about where we are right now. And, it doesn't mean that they don't have the power to make a change down the road. We always sleep with one eye open whenever you have the government as your main payer, but right now it's pretty stable.
Great. Lisa, how's reimbursement for your services?
Yeah, well, when we started in 2017, 2018, Medicare introduced the first billing code for remote patient monitoring in January 2018. And at the time, it was valued at $59 per patient per month. So that's what the clinician would receive by using our platform. Over the last 3 years, Medicare and Medicaid have increased billing codes from 118 that are relevant to our platform. They've expanded the scope of the platform, the programs rather, to not just cover remote patient monitoring for mental health and addiction patients, post-discharge care if you were in a skilled nursing facility. So the programs have expanded. But more importantly, from the clinician's perspective, our typical clinician client now receives $372 per patient per month from Medicare and Medicaid, compared to that $59 just 3 years ago. And Medicare and Medicaid have already indicated that next year they'll be adding another 5 billing codes. So they're expanding the scope of the programs again, and they'll be increasing the reimbursement reimbursement amounts for the existing billing code. So certainly the trends over the last 3 years have been extremely favorable in our space. And I think in the industry as a whole, we're all anticipating that that will continue to be the case, because fundamentally, moving care from the acute setting and preventing these complications in chronic disease patients is the only way the healthcare system is going to continue to be sustainable. We cannot accommodate this many patients with preventable complications in the ICUs, and we can't afford to continue to pay for hospitalizations for preventable conditions as the population ages and grows, and therefore the chronic disease population continues to significantly expand. So, it really makes sense from Medicare and Medicaid's perspective. This is something that will save them tens of billions of dollars a year. So I really do think this is long-term likely to be a continued trend where the reimbursements and investments in proactive preventative care in the home will continue to expand.
Great. And Lisa, one thing that we've seen over time is sometimes it takes providers a long time to accept change in healthcare, and sometimes it takes patients a long time to accept it as well. What do you see from providers and patients as it relates to telehealth and remote patient monitoring?
Yeah, I mean, our average physician practice who works with us as a client is generating over $1 million in new revenue at a very high profit margin by deploying our system, by offering these virtual care preventative programs. So, there's certainly a lot of appetite on the clinician side. When we started, we were very much missionaries in the space and had to really educate clinicians back in 2018 on the value of using a platform like ours. And now we get more inbound calls than we do, spend time on going out and soliciting clients, because they've heard about the platform, they understand the programs, and they recognize that, not only is this a significant new revenue stream for them, but helps them avoid some of the financial penalties Medicare and Medicaid assess if a patient population is hospitalized more than the average Medicare or Medicaid patient. And it definitely drives better health outcomes for these patients. They avoid the hospitalizations, their health stays at a higher level for longer. So, I think the trend in reimbursement is going to continue. And there's certainly been a lot of increased acceptance and adoption of virtual care technologies because of the pandemic. So even some of the older clinicians who were very leery about using technology and not seeing patients in the office have really adopted technology as a way to reach patients. And that's expanded significantly on access to care for patients. And because these patients tend to be older, as Casey was saying, they're typically 65 and up, and they have complex clinical conditions, they are actually very motivated to do anything that will keep them healthy and at home, avoid the hospital admissions, avoid having to go into long-term care. So we get over 99% adherence with our patients and really strong adoption in the community in general.
You have to be careful about talking to us about us old people that way, because I'm over 65 myself.
Okay.
Anyway,
We got
Rich.
you set up, Brooks. Don't worry.
Right, exactly. That's why I do this, Rich, talk about reimbursement for your services and what the trends have been recently.
Sure. So we're similar to Casey's story. We build DME codes. Our reimbursements a little bit different in that for our kind of older products and services like our oncology pumps that we've been doing for 30 plus years, reimbursement is very stable. Like it's been cut. We've gone through competitive bidding multiple times since I've been here. It's one of those things that has been cut to a certain level, and now it's just stabilized. There's really no more to take out of it. And I think the payers now know that, you could probably continue to bring it down, but you would start to lose vendors in the marketplace. And when ultimately healthcare is saving money by sending patients home on pumps, why would you want to do that, right? So that those numbers have been very stable, and they have been for years. We don't think that should change in the near future at all. Like Casey said, you never know with reimbursement. I think the payers are in the business of cutting reimbursement. That's what they try to do every day, right? The good news is I think we all have teams that their job is to fight against that and get as much as possible for the services we provide. The newer products and services, probably similar to telehealth, where new codes come out, they tend to be a lot higher because it's a new program. They are getting people out of the hospital. It's something different. They're trying to promote it and move people in that direction. So for us, whether it's the wound care piece or soon to be lymphedema, even in pain management, some of those programs don't even have the codes that they will over time. And that's good news, right? That will generate more interest by patients, more interest by the payers. and the clinics to send people home as reimbursement changes. So it just depends for us where you are in the business. The core products are very stable. The newer products, actually, you're seeing a little bit in rise in reimbursement. And I'm sure as those mature over time, they'll tick down a little, but reimbursement just isn't one of those things. Maybe 10 years ago, it kept us up at night. I don't think it does anymore. I think we're in the right space. If I was in the hospital business and worried about what I was going to get for my global fee to have a patient in there, I might be worried a little more. But I think all three of us are in the spot where patients are going to be pushed out towards us, and the payers understand that. And Medicare and Medicaid's a little bit different because I don't think they always make the decision based on the best interest of the patient, whereas the private payers do because they're paying members, right? So they just have a different outlook on things, and they really care about patient satisfaction and outcomes. Medicare, it's more about a budget line item than anything else. But I think over time, payers have realized that whether it's antibiotics in the home, chemo, non-invasive vents, lymphedema, getting people home and getting treated, and then supporting them with telehealth, there's no reason to cut reimbursement in the home. It wouldn't make any sense in the grand scheme of things.
Sure. So if we've established, which I think we have, that the future for home health is bright and the reimbursement picture is stable to improving, I'm just curious what each of you thinks might be the keys to turning your company into big, fairly fast growing and profitable businesses. Maybe we'll start with you, Casey.
Sure. I mean, for us, it's going to be finding people. We're in 45 states. We've got over 600 people deployed across that 45 state region. And every time we put a clinician 60 miles down the road, that is a new territory for us. We've always grown our business organically. From 19 to 2020, we grew 60%. And, we're not trending at that number. The larger you grow, the harder it is to keep up with that number. But it's all about finding people right now. The other thing I'll say is what's going to contribute to our growth is our technology platform that we've built out to assist our clinicians while they're in the home. Where an RT used to be able to handle 30 to 40 patients, now we can get them up to 50 to 60 through the use of a telehealth platform on our tablet that acts as a hub in the home that talks to the ventilator and talks to anything that's Bluetooth connectable to the hub. So those two prongs right there, that human interaction mixed with technology, allowing us to be more efficient, and then getting our hands on more people are going to allow us to grow. We've also just to wrap it up, sure, we have developed a new staffing division at Biomed. We started Viemed Healthcare Staffing, and that's an initiative to beef up our in-house recruiting platform to where we can get our hands on more people at a faster rate. We did a number of staffing deals through the pandemic. That was kind of a one-off solution for some of our hospital providers that needed it. So we've just taken that to the next level and built out a whole division.
Great. Rich, what are the keys to your future?
Yeah, I think the people piece is for sure a challenge. We're in kind of the phase now where we're gearing up for the future in what we see in 22 and beyond. And it's a challenge, right? And it's like any other time where you can probably find bodies to put in the building, but I don't think any of us want that from a culture standpoint, right? You want to find the right people, the right skill set, and someone that fits into your culture long-term. And when you're dealing with patients, you have to be very careful on who you bring in the building, right? And to be that picky, like we probably all are, it just becomes that much more difficult in the times that we're seeing right now. And so for us, that's certainly a challenge. It is today as we gear up. I think the good news, at least from the Infuse System side, is we have these platforms built and our clinical teams built out and our biomed teams and revenue cycle and the contracts in place. As long as we keep our patients in focus and make decisions based on what's in the best interest of our patients long term, it just comes back to old-fashioned execution, right? As we add in a new therapy, as we add in a new product, making sure that we're in the right market at the right time with the right team in place. I don't have any doubts that any of us will do that, but it's always a challenge, right? It's always something you want to keep an eye on. But absolutely, people is a very tough thing, and I don't think the three of us are alone in that world right now for sure. But it's a challenge because you can get people in, but if they're not the right people, your business can really suffer.
Sure. Lisa, what are the keys to your future?
I mean, for us, we're more of a conventional sort of software as a service platform or company. So, we have the traditional high margins, over 45% EBITDA. So we're not really as dependent on human resources to grow. We expect to double growth quarter over quarter for the foreseeable future. We ended the quarter ending June 30th at a run rate of about $1.5 million a quarter. We'll end this quarter rate of about $3 million a quarter. We just ended the last quarter, September 30th, at $3 million a quarter. We'll end the quarter December 31st of 2021 at about $6 million a quarter, so $24 million annually. So we're growing quite quickly now. The real sort of downward pressure on our business was during the pandemic. When the pandemic first started, clinicians really had to move away from kind of dealing with their chronic disease patients to primarily seeing just COVID patients. And once the vaccine rollout got rolling in the States at the beginning of this year, we saw more clinicians saying, I can't afford to keep my chronic disease patients on the shelf indefinitely. And there's a lot of lost revenue around, not providing your standard annual preventative care and monitoring for those patients. So in the second half of this year, we've seen this really tremendous growth as, even in the advent of the Delta variant, clinicians are really recognizing that they're going to have to keep their chronic disease patients healthy and at home. They can't go back to the standard model of bringing them into the office. And so for us, we're growing very rapidly organically because there's significant demand in the market that's fueled by kind of a perfect storm of conditions, the significantly increased reimbursement around these programs, more awareness around the importance of keeping people out of hospital that's been driven largely by the pandemic. And where we are hiring some human resources, so we have our care management center that acts as an extension of the physician's office. And for that, we hire medical assistants and some nurses. And we just hired 5 new care managers, and we had 500 qualified applicants for those positions. So we find that, because our care managers work from home, so they can be anywhere in the United States or any of the US territories. A lot of the medical professionals right now, medical assistants, nurses' aides, and nurses don't want to be in the acute care setting. They don't want to be in the hospital. The risk of exposing themselves and their families to COVID is too high. The abuse they take from people who, maybe aren't as convinced that the pandemic is real or as significant as they're saying, it's just not for them. It's an exhausting environment that poses significant risks. So we have a lot of demand for those positions. So I don't think we'll see in particular any human resource constraints on our growth.
Great. So several of you mentioned COVID. Obviously, it's been a key topic over the past 18 months and even recently with the Delta spike. Lisa, if I'm hearing you correctly, you might actually characterize it as having been a positive for you. Why don't you start off and talk to us about the impact of COVID and what it's meant for you?
I mean, initially, the impact of COVID on our business was definitely negative. We really kind of had to tread water from March 2020 until the spring of this year, 2021. Most of our clinicians kind of closed their practices to anyone other than COVID patients because they didn't want other patients coming in and potentially being exposed. And they really had their hands full. I mean, COVID was so pervasive, especially in the southern states where we were really active before the pandemic. So, we had a very kind of slow year during the initial pandemic phase, during which we really worked hard on improving our software so that it would be really robust and scalable and ready for rapid growth that we knew would come post-pandemic. One thing that we found really interesting, obviously the pandemic was very positive in accelerating the adoption of virtual care technologies, but when the Delta variant started to circulate, we wondered, was that going to put everything back into the sort of stasis mode we'd been in during the initial phase of the pandemic. But what we've seen is that clinicians are saying, I can't indefinitely ignore my chronic disease patients. So I have to find a way to continue to provide care for those patients. And it has to be something that keeps them out of the hospital because the burden on the ICUs has not gone down. And even after we get past the Delta variant, which I certainly hope we will do in the short term, there's going to be a backlog of elective surgeries and cancer treatments and all of that for years that the hospitals are going to have to work through. So our clients are consistently telling us that the hospitals in their communities are saying, do not send your chronic disease patients to us for admission. You have to do a better job of keeping them healthy and at home. We can't cope. So that's created a lot of pull for our product. I hate to say there was any positives to global pandemic, but it's definitely accelerated our business significantly.
Great. Rich, how has the COVID impacted you?
So it's impacted us really multiple ways, and it just depends on the service we're providing. So on our pain management piece, it hurt us, especially early on when elective surgeries basically went offline for 6 months or so. That's been a lot better this year, although we're seeing a slight impact now with Delta. I think hospitals are better prepared now with PPE and understand you can't shut down a revenue generating center like an OR suite to the degree that they did the first time around. So it's hurting us a little bit on the pain side. It's actually helped us on our DME side. So rentals and sales of pumps spiked pretty dramatically last spring of 2020. I know ventilators get a lot of the press, but every time someone's intubated, they're going to need infusion pumps to get their drugs and their hydration and their food. So we saw pump sales and rentals go up quite a bit last year, probably more than we even thought we would see. So there's almost a natural hedge between those two for us. So if elective surgeries come offline because COVID's increasing, more people will probably need infusion pumps, so rentals and sales will go up, and most likely they're going to balance long term. And it may ebb and flow, right? As more variants come out, I don't think this is going away anytime soon, but we'll see good times and bad, and those two businesses will kind of ebb and flow back and forth. I think the challenge, and it hasn't been a challenge for our business, but more of a societal impact, is the fact that people just aren't getting preventative care. And we noticed that in the oncology business, where people weren't going in for their colonoscopies and their routine checks. And not just that, but whether it's, heart health or whatever, people weren't going in to do what they should do and get screened for all types of diseases. And we started to see that actually this summer as things shook loose a little bit after the vaccines came out, that our new patient load spiked in the same accounts. And it wasn't because we added new business. I think more people just finally came back and got tested. Unfortunately for society, that's where you're going to get people that are sicker than they would have been if they came in last year, right? And it's unfortunate. So we saw a spike in patients from a society standpoint. I think it's terrible news across the board, not just in cancer, heart disease. I mean, you name it, right? Everything that Lisa deals with probably. People are just that much sicker because they were a year later in catching what they were going to catch a year ago.
Absolutely.
And I think it's human nature even now. It's not that the hospitals are unwilling to screen patients. I think personally, I know people that are afraid to go in and get their test because they don't want to walk into a hospital right now. Not for preventative care, right? If it's an emergency, it's one thing, but do you really want to walk through those doors if you don't have to and run the risk of catching COVID? So long term for our business, I think we're fine. I think we have a natural hedge in the business, and our core business is kind of outside of COVID, but we will see some ebbs and flows based on preventative care. And I think across healthcare, we're going to have a much bigger problem for years to come with people that are just holding off on things.
Casey, talk to us a little bit about how COVID impacted you.
Yeah, as the largest independent provider of ventilation in the country, I felt like I had the last tank of gas and a hurricane had just come through. So that's my Gulf Coast analogy. But we, the first order of business when the pandemic began for us as a ventilator distributor was to make sure that states and hospitals had the equipment that they need. So we went through the first couple of months just distributing as many ventilators as we possibly could into the epicenters for the patients who needed it the most. From there, we transitioned into really just being the thought leader in ventilation, teaching all the clinicians around the country who are used to just dealing with one type of ventilator. Now they have 12 different brand names that they have to work with, just educating them on how to use it. We put up a YouTube channel that got thousands of hits in a very short period of time. But I was proud of our clinicians for stepping up and doing that. That kind of transitioned into what else can you help us with, Viemed? And we did some PPE deals. We started dabbling in staffing and did, place quite a bit of nurses and RTs in areas where they were needed the most. We stood up a contact tracing call center for the state of Arizona that, they asked for, which today transitioned into a vaccine tracing contact call center, if you will. And so that's a business model that we created from the pandemic that's actually here to stay. We're finding other needs for the call center as we sit here today. But those were the tailwinds. We had north of $30 million in COVID-related business in 2020, but our core business was down because the headwind was that we had access to physicians, our referral sources that we really couldn't get to. And so much of what we do at Biomed is getting in front of the disease state and being proactive and educating physicians to not wait for patients to be on their deathbed but to interact sooner rather than later so we can improve quality of life. We weren't able to do that in 2020. However, in 2021, we ramped up, not knowing that the Delta variant and this second spike was coming, but we never stopped hiring. We put salespeople out across our coverage area. We trained them on how to use our technology platforms. Remote patient monitoring was an offering that we rolled out in 2021 as well. And we were just giving them solutions for them to manage their patients from afar to where they could safely monitor the patients. They didn't feel like they had to come in and see the doc for every little bitty thing. And so when you bring that type of value, you become sticky as a referral source for everything that you're offering that referral source. And, so it's for the most part, the pandemic has been a tailwind for Viemed.
Great. So as we wrap up here, it sounds like all of you are optimistic about the outlook for your company and for healthcare in general. But if you could just help us in closing to sort of summarize why you're excited about the outlook for each of your companies, I think it would help us all. Rich, why don't you start off?
I've been here for 18 years and I've said it, I think, on multiple earning calls recently. Every time I turn around, I'm more optimistic about our business. And I think it's kind of twofold. Part of it is the move to home health, right? So I think all three of us occupy a similar spot, and that we're in the right spot at the right time as the dynamics in healthcare change. As InfuSystem specifically, I think we're in a good place because we kind of have multiple paths to grow the business. It's not just our old oncology business that's been around for 34 years, and it's wound care, it's pain management, it's lymphedema, it's our DME side of the business. They're all going to grow fairly rapidly. I've said recently that it took us 30 years or so to get to 80 million in revenue. I think we'll double that in probably 3 years. And the good news is it's not us crossing our fingers and hoping that that's going to happen. We see multiple paths to get there. We don't have to hit on every program we've put out there. If one or two go the way we expect them to go, we'll get there. If they all go, then we may more than double the business in the next few years. So it's a good time to be in this spot. It's a good time to be with a company that's so well established in the marketplace, that really has these platforms kind of perfected, and we've spent a long time perfecting them. So from an optimism standpoint, it doesn't get any better than it is right now at this company.
Great. Fantastic. Lisa, why don't you talk to us about your outlook for your company?
Sure. I mean, I think home health, providing more proactive preventative care and reaching these patients in the home instead of bringing everyone into the acute care setting is definitely the future of healthcare. It's the only way that, for insurers and payers, it's going to be sustainable going forward. And it's certainly a win, across the board. It's better for clinicians, they get new reimbursement streams. It's better for patients. They have much better health outcomes and quality of life. And it's better for the payers. It's more sustainable. And for our company, we've really, again, as I think Rich was saying, this is a perfect storm of conditions. We're in the right place at the right time, and reimbursement levels have increased substantively. And so we're getting a lot of organic growth that's really, being led by the market as opposed to us having to, push the solution. There's a tremendous amount of market pull. So I expect the next several years we'll see really explosive growth from our company. And we've been, in some ways fortunate to have that kind of quiet year during the pandemic where we were really able to prepare for that growth. So I think we're in a very good position to capitalize on that going forward.
Fantastic. Then we'll wrap it up with Casey. Talk to us about the outlook for Viemed going forward.
Yeah, I mean, I'm most excited about the data that we have been producing. We just published our second study that came out 2 weeks ago. They're both showing very similar trends. For every 5.5 patients we put on therapy, we save a life. For every 8 or so, we save a hospital admission. For every 5, we save an ER visit. Our proof of concept study, KPMG, showed that for every patient we put on therapy, we'll save north of $20,000 per patient per year for the payer. And so that's the type of data that we need to affect our market penetration number. We only have a 5% market penetration number for the patients that qualify for our therapy. So this means that 95% of the folks that have COPD and chronic respiratory failure or some sort of neuromuscular disease with chronic respiratory failure, they qualify for our care, but they're going back into the hospital. And so that's the blue ocean of opportunity that we see for our particular business. It's why are we at 95%? unpenetrated, it's because of the lack of data. Now we have the data, so we're excited to roll this thing out and really, double this business in the coming years.
Great. Well, I really want to thank each of you for taking time to talk with us today. And I want to thank Joe and Lytham for sponsoring the discussion. Thought it was excellent. And we'll talk to you all soon.
All right. Thanks, Brooks.
Thank
Thanks,
you,
guys.
everyone.
Thanks,
All right,
Joe.